Hello, viewers. Welcome to another edition of Health Forward. Today, we have another very special guest with us, Mr. Joy Chakraborty, Chief Operating Officer at P D Hinduja Hospital, one of the most reputed institutions in the country. If I have to sum up something about Joy of what I have known him and seen him in the last decade, I think he's all about simplicity, intelligence, sharp mind, and a man of clear action. Welcome, Joy, and thank you for being with us here today, taking out your time and agreeing to share your experiences with us and your journey with our viewers.
Thank you, Gaurav. It was lovely to get the invite and pleasure to be part of this discussion today. And the way you have introduced me, I'll try to do some justice during our interaction to see that viewers, they also consider the same at the end of hearing me.
You don't have to make any extra effort. You just have to be yourself, and I'm sure people will know who don't know you. So, Joy, starting with first, I think what is very important for all of us to learn from you is how did your journey in healthcare began, and what actually drew you into healthcare field? What was your biggest attraction to get into healthcare?
See, let me tell you, Gaurav, and I'll be very frank and honest. After 12th, I wanted to be a doctor. And I come from West Bengal, where during my time, it was very difficult, competitive, and the system was not that convenient and comfortable for me to get a medical seat. Then I pursued my undergraduate program in human physiology. So I wanted always to be there in that field. And then I thought, if I want to become a doctor, if I want to become doctor of doctors, then I need to pursue in the area of management and can come back to this stream. So I did my post graduation in health management, and that took me or helped me to get into this hospital or healthcare front. And I was very clear from the beginning that I need to work in some places, I need to work in some institutions where I can learn and grow myself. So during my end of this management program itself, I did my internship in down south in a private medical college hospital and worked in multiple small places during my internship, and that gave me a huge input and motivated me to pursue in this hospital healthcare field. And since then, on this 1st February, I'll be completing my 27 years in healthcare journey. So I am in healthcare delivery.
Very interesting journey, and I think if we look around, a lot of hospital administrators who are either doctors or non-doctors, somewhere or the other, either they have become doctor and they want to get into administration, or they would have wanted to become doctors and they got into administration. So I think it's very interesting that way. But when you look back in your whole journey, will you be able to share with us any early experiences or roles that largely most shaped the way you think or operate as a leader today?
See, I'll tell you, when I started my career in Chennai, in that medical college hospital, it was the private side of the hospital. And when I joined, it was like a 250, 300 beds. And when I left, it became 800 bedded hospital. So the private part of the hospital I'm talking about, not the free hospital which was catering the medical college students. So I got my first posting as a trainee in operation theatre, and probably I was fortunate enough to get that posting, which gave me a completely different perspective. Many a time I see today, when somebody joins in hospital with my kind of background, they work in the non-clinical area, they work in the back office, they try to learn things. But during that period in my operation theatre and followed by ICU, in these two stints gave me a huge exposure to this clinical field of the hospital administration, healthcare management. And during that, I interacted with some of the stalwarts in clinical fields. I happened to see some of the best clinical works, what can happen including the heart transplantation. I happen to see some of the complex operation model. When I say complex, I mean involvement of multiple professionals and working for the same cause, whether it is nurse, whether it is anesthetist, whether it is surgeon, and even surgeons from different super specialties and specialties. They were coming, how they are forming a team, how they are delivering for the cause of the patient, and how they are trying to give back life for them. Those are some of the things what gave me a very early kind of exposure. And then I realized that if we need to work and succeed in this field, especially in the healthcare, we have to work like a team. Everyone is equally responsible for the care delivery. Someone is maybe spending more time with the patients, but ultimately accountability, ultimately the kind of responsibility lies with each one is very important. We need to respect each other, and then only we can grow in this field. So these are some of the inputs what gave me, and Operation Theatre gave me another very I should say learning, that is how do you manage your when you have this kind of scenario, how do you manage your critical resources in a complex environment. So that was another major learning for me.
I think very well said. And if I have to kind of look around us, what's generally told is that anesthetists make good hospital CEOs largely. But then I think you rightly said that Operation Theatre, starting with that, I think you were lucky enough to get that kind of an opportunity, because as you said that it helps you because it deals with every facet of patient process, from booking a slot to dealing with doctors to dealing with highly trained staff, managing resources, critical resources, managing equipment. So I think it's, and at the end, managing some good news and the bad news. So I think largely it serves as a mini hospital within itself. So if you have an experience of that, it said that you have experience of the whole hospital.
So incidentally, you touched upon one of the very critical part, that some of the best administrators are anesthetists. So my first boss happened to be the head of anesthesia, and who happened to be the medical director of the hospital also.
Okay.
So I have worked very closely with medical director and who was an anesthetist. So that was also a very good input what I got.
Yeah, thank you. You have been into operations for so many years now. If operations came with a stress meter, which department do you think would break the device first, based on really the high amount of stress, and why do you think so?
See, let me put it like this. You need to love and you need to enjoy what you do. So there will be challenges, but if you take that as a stress, then probably you will not be able to perform. So I don't take something as a stress, that it is giving me stress or it is giving me nightmare. But some of the departments where, especially, I'll not say it is going to be common for many hospitals, but for my current role where I am in Hinduja Hospital, one of the challenging department, I'll tell you, the from where I get every day a lot of challenges is like my admission department. The reason is the hospital operates on a very high occupancy, and a lot of people, they look for bed. People, they reach out to us when they don't get a bed at the time they need, and sometimes I feel bad that they are looking at us for some help, but whether you are able to do the justice for that. So when that kind of balance and needs to be maintained, we face some challenges. For any administrator, I think it is a good challenge to have, that they are overflown with patients and they have so much of things, and being a private hospital. But I enjoy that, but at the same time it takes your time. So if you say that the department gives stress, I'll say this is one of the departments what does. And secondly, in some situation when the patient interactive departments, whether it is OPD, whether it is inpatients, Wherever there are situations where patients are demanding or patients' care are somehow compromised and situation comes up to manage the situation, deal the situation, that becomes another scenario. But I think if you have a well documented SOPs and processes in place, all this can be overcome.
Yeah, I completely agree with you on this. And admissions definitely become one of the most challenging because you have a chocker block in emergency, you have patients who are being discharged. So it's like multiple things happening while there is a priority that these patients need to be admitted in the hospital. And nobody can understand the stress more than the healthcare professionals by themselves, because I think we saw the actual real time stress when during the pandemic COVID happened, and beds were like a scarce commodity, and was really to be looked at. Uh, so Hinduja largely hospital is known for its operational discipline, and I'm sure you have played a major role in that. In your view, what's the single most important operational shift that you feel hospitals must make today to stay resilient and high performing?
So I have multiple things to say. I'm going to mention some of those. May not be in order of priority or preference. The first thing I'll tell you, there should be team in operations who are able to do multitasking. They should not be cocooned in one department, one function, and familiar to manage things only in one area. So when you have a multidisciplinary team, not disciplinary, multitasking team, and that is working for you, you will be at little ease. The second thing is where you have people who are properly trained and equipped to manage things. Sometimes we come across people who manage a function, who manage certain things, but they may not be the best to do the things. So you need to equip them. Sometimes we don't like, or we fire people without knowing that we have not equipped them properly. So that is the thing what I think where there are a lot of things can take place. As on today's environment, I'll tell you, the operation should be ready. Operations department should imbibe new technologies. Now everybody is talking about AI and all. I'll say it is not only AI. There are multiple other things which needs to be embraced by the operations to ensure that they are relevant and pertinent in today's world. The next I will talk about a team which is not only ready to deliver good patient care, but they have empathy. Today the patients and the community, when they reach out to a hospital, they look not only for the excellent clinical care, but they look also for the other supportive care. And in the other supportive care, the first thing what they look for, that how I have been treated, how I have been considered as a unique patient, how it has been considered that my needs are different than others, how I have been distinguished. So when all these are included in your care, that becomes good. So in absence of all these, the operations may get affected and operations may not be appreciated by the patients and their relatives.
I completely agree with you, and I think you have very nicely put forward all the key points. And somehow, in my earlier conversations with other guests, also, I think this point of being empathetic, walking in patient shoes or being kind, I think that has really come out in every conversation that we have had, which people are looking out for today, which means that there is a major shift that we need to do as healthcare providers. And I completely agree as well with you on the idea of multitasking, because that just saves a lot of stress. Plus it's a great career advancement for each of the healthcare professional, because as you rightly said, they are not cocooned in one job or one desk. Rather, they can get on many desks, and they can get knowledge about many other pieces. So I think great points put forward by you. When you look when you look at patient safety in a tertiary care hospital that is really very busy, which is that one area where you think, even small improvements if we do today, it can actually result in disproportionate, very large gains?
So there are 2 to 3 things again I will tell you. Today, everybody hate to wait. They hate to be, in the queue or delay. So things should be whatever is possible, you get it done instead of making them to wait for the service. So I'll give you an example. A patient or their relative, they come to a hospital to meet a doctor, but if the time they spend with the doctor is very less in comparison to the time they spend in going to the counter, making payment and looking for the consultation room, then it becomes very annoying for them. So we need to see how do you take away the kind of non value added activities for an overall process, the way you think about lean and Six Sigma way, and how do you engage patients when they are comparatively free, or they can do it at their ease, maybe at home, and they can come directly for the service what they want to avail. That is the first thing what I will say. The second thing, which is again related to waiting but in another way, today patients are very impatient. They feel that the moment I have given my sample, I have undergone a test, things should be ready so my doctor can take a quick and early decision on my further treatment. So when that kind of mindset they have, at that time, if the reporting of diagnostic test, reporting of lab test takes time, they don't like to be, they don't like to see that kind of situation. And third, I'll tell you how respectfully and dignified way I have been treated. Today, when a patient or patient relative is in the outpatient department waiting, and the way they have been called, the way they have been greeted, the way they have been, taken care of for their whole journey, that becomes one of the key factors. So I'll tell you, when I say about technology and all are part of it, but these are some of the things people, they want to be handled or managed very quickly. They want their solutions to come very early, and thirdly, they want to be treated respectfully. So these are the top 3 things which can take your patient's wow experience one notch above.
I agree, and I think in today's world, in the world of fast food and getting Ubers in 5 minutes and Swiggies and Instamart or Zeptos, people just don't have the patience to do anything or wait anywhere unless it's really required, and they don't have an option. So I think I completely agree with you, and it's a very well put forward point which people need to consider. While you also touched on the whole empathy piece again, so let me move towards that a bit more and take your pick up your brains on that, where we are talking about service excellence. It's really spoken about a lot of people speak about it today, but it is something which is really difficult to sustain. So what is that one practice or mindset that you largely believe that healthcare professionals should follow or should have it in their practice that would genuinely move this needle on patient experience?
I always tell one thing to my staff whenever I get opportunity. A very simple thing, that you develop your process system in a way and put yourself on the other side. Put yourself in the patient's shoe and see whether you want yourself to be treated the way you are treating your patients. So if you feel that yes, it is good, then it is good to be extended to the patient family. There are simple things that when somebody comes, if you enter a hospital and if you don't know where and how to reach, if somebody doesn't come forward to help you, If you're waiting for a doctor or for a service, if somebody is not bothered and make you to wait for a long time, if you're waiting to get some information from the hospital and nobody gives you, the way you will feel, that is not, if that is not satisfactory for you, then you should create an environment for your hospital what you expect to happen. So there is a huge thing on communication bit of it. So there is a huge training what needs to be undertaken to ensure that communication is the key, especially for this healthcare service delivery. When I spoke about the empathy, this empathy doesn't come, or someone doesn't inculcate within themselves in their own. It is supposed to be a culture, it is supposed to be an environment which helps patients, which helps employees to extend this. So I'll tell you, the in some of the Western world hospital, and I'll take example of a Cleveland Clinic. So they have a huge this patient experience, service excellence kind of model. But what they always say, that make your employees happy. Show your empathy for your employees. If your employees are happy and they are satisfied, automatically they will extend a service which is great in class and best in class. So instead of working on patient experience, they work on employee experience, and that ensures them a better care. Then what they have done, and which I love to follow time to time, is the story of empathy. In the history or in the recent past, in the hospital, the kind of feedback, the kind of patients stories are there where they have expressed their empathy, they have expressed the kind of service they have received. If you can record, if you can monitor some of those and percolate it down, and continuous basis you do this training, then automatically your employees also will be in a same way, they will express their empathy whenever they interact with the patients, and that becomes the best possible experience for anyone.
Thank you so much. I really have no words, because I think you really summed it up nicely on all the things that people should ideally be looking at. And thank you for sharing that. If we have to change gears or switch gears to a different perspective, largely on the workforce expectations, because you touched on it briefly, on being kind and being empathetic to our own teams and our own people. This whole piece has actually changed dramatically post-pandemic. So what are the cultural shifts do you believe are now essential for retaining and motivating hospital staff?
See, one thing everybody talks about, that give the best possible package to retain your staff. I will tell, not only the package, there are many other non-financial things also motivates. And you took the example of the COVID. Let me tell you, and I'll take the example and I'll start from there, though we have many other things to mention even prior to COVID. During COVID, probably many hospitals, what they tried and they strive to achieve, and we at Hinduja, we have achieved. Can you imagine that every day we used to run exclusive bus services for our staff, which used to go up to 50-55 kilometers away from the hospital and drop them and pick up them every day. Some of them expressed their concern that if they work in hospital, they go back and then there is a chance for their family to catch the infection. So what we have done, we have made their accommodation stay close to the hospital by renting out places, because we felt when they are ready to serve for the humanity, for the cause, we also need to give back. And during the first two wave of COVID, there was a huge shortage of beds, things and all. So we have ensured not only our hospital staff, if they get COVID, also for their family, their dependents and everybody, if it is not in our hospital, because in Mumbai the scenario was that hospitals were identified to treat certain types of patients. So for example, those who are critical, those who needs this kind of high-end support, they will be only admitted in Hinduja, rests are not. So we took that extra effort to ensure that they get a place in other facilities, so they don't remain and they are not under distress. So we have done some of these out of the turn and gone out of the way, which gave a huge confidence in their mind. Now coming back to some of the non-COVID thing. Today, I can tell you that probably many hospitals have not explored things like employees. Certain types of employees, they may need to take loan for purposes like their kids' marriage, education, some basic needs what everybody has, and they may not be well prepared to handle that. So in our hospital, we have a cooperative credit society, and that cooperative credit society gives a loan at a throwaway interest rate what no other financial institution or non-banking institution can give. So that kind of, we have given corpus members, they contribute if they want to avail any facility, and from there we have made it business wise viable, and we have ensured that everybody gets benefit out of this. We have a huge scheme to support our kids education and future oriented certain career aspiration to be made, and like that I can continue to speak. So we have ensured that they get it. Secondly, how do you equip them, how do you get them trained? So we have programs to support, whether it is within the hospital, whether in tying up with external institutions, and also to the extent we have our tie-up with King's College London, where their faculties, they can come down and in certain nursing clinical area, management area, they impart training. So everybody, they feel empowered, they feel their career is growing, and they continue to stay with us. And as a result of that, I can tell you our hospital probably has the lowest attrition rate in the healthcare industry, and on an average an employee works in Hinduja Hospital for 18 to 19 years. So that gives in terms of measurable dimension, that is, it's not that we are only doing things, but at the same time we have the kind of result and what you are enjoying, the kind of commitment to the institution, the kind of trained people within the institution, and most importantly, a satisfied employee who is going to keep your patients, your customers also satisfied.
Yeah, very, very important and key points, I think, shared by you on this platform. And these are really very critical. And I would also like to just add an example wherein, Chairman Apollo Hospitals, he is made it mandatory and is a directive to everybody that all employees need to undergo health check in the month of December, January, so that, he would like to see the report. And this has actually saved few people wherein largely at some point of time they could have got a cardiac arrest or they could have got a stroke because of being at high risk, so immediately care was provided. And I think it's very critical and important to make your people feel important first, who are serving patients on your behalf, from organization's perspective. So very, very, very
Gaurav, you reminded me what I have missed to mention here in the medical care point of view, that in Hinduja Hospital, all the employees and their immediate dependents, that means spouse or dependent kids, all of them are entitled for any amount of free treatment in the outpatient and inpatient department.
Yes.
So they don't have to pay anything and they can avail any treatment in both the facilities.
Yeah. That's great. I think something similar happens with us also. But thank you for sharing all those examples, which are live examples, and I think for many others to follow if they are not doing it as a great practice, and how to change the mindset of thinking about your people first and then thinking about your patients, because happy people can make happy patients. Ultimately, what you very rightly pointed it out earlier in the conversation. Joy, my last question to you is, if there is a fresher or a young professional who just got into healthcare and wants to become, let's say, 10% of what Joy is today or what you have achieved, what is that one advice you would like to give it to that person?
See, you have made a very big statement that 10% of joy, what he has achieved. But I'll tell you, irrespective of thinking of what they are going to achieve, if somebody has a serious career aspiration and they are very keen to prosper in their field, I'll first tell you that, and management, you talked about the young professionals, so from whatever background they come, I think healthcare is a field where you need to do a lot of hard work initially to get an overall uh, understanding of the environment. It is a very complex kind of institution, health hospital especially, where you have so many diversified professionals with so many diversified kind of background. And if you really need to prosper in that, you need to understand each one of them. You need to know the nuances, what it means. You need to know every small bit of activities, what happens everywhere. Only then you will be well equipped to take the next level up, and then slowly you can go up and up and see the actions what are happening in the ground level. Otherwise it is very difficult to sit on the top, manage things without having the realistic experience and first hand experience.
So thank you once again, and I think all the viewers would agree with the fact what I said at the beginning of this session is about your simplicity. So you did speak about healthcare, you spoke about your hospital, you spoke about your people, you spoke about your team, but I think a lot of credit goes to you also for all the contributions that you have made in your respective organizations where you have worked, as well as to the healthcare community, and that really speaks volumes about you. It was wonderful having you today. It was a great conversation. I really enjoyed talking to you and learning so many things about you on this different platform. But I would really appreciate your time that you spent with us today and shared your experiences and your journey.
Thank you, Gaurav. It was lovely meeting you once again, and expressing some of my thoughts in this platform. And I'm sure we'll have several more other occasions to do so.
Yes, thank you so much. Have a very good day.
Thank you. Wish you the same.